Last night, Checkpoint identified $4.3 billion of capital expenditure being sought by just 3 of the country's 20 DHBs, all 3 of whom say it won't add beds or increase capacity. This is catch-up spending. We've been talking about this, and at Middlemore it involves getting staff and patients out of buildings that are rotting, mouldy, contain asbestos and are earthquake risks. We've also spoken this week to DHB CEOs and senior insiders who've told us of the pressure, relentless one of them said, on them to deliver operating surpluses and to not advance business cases for money for capital development. Well, today the Health Minister met the chair of the Counties Manukau DHB to discuss the condition of its buildings and its books. And while the DHB assured the Minister there is no risk to public health and safety from the buildings, the cost of repairs and remediation and how long it will all take are uncertain. We're returning now to our interview with David Clark that dropped out earlier in the program. The Minister and this government had pledged an $8 billion increase over 4 years in Vote Health, and I put it to the Minister that $8 billion won't be enough.
No, that is not going to be enough, John. Absolutely right. I'm aware, and these are ropey numbers, so please take them in that context, but the best numbers we have at this stage are that it might be as much as $14 billion over the next 10 years that is required in infrastructure spending. That is no small sum. I don't think anybody would say
$14 billion over 10 years.
Yeah, and of course I want a better picture of that, and so I am requesting that a national asset management plan be set up. I think one of the most shocking things to me is to discover as Minister that there is no asset management plan in place for the New Zealand health system. Now, I think most small business people in New Zealand who had a business with a turnover of $1 million or $2 million or $10 million would have an asset management plan in place. At least they'd know where their assets are or what they are.
Absolutely.
In the health system, I'm afraid for political reasons or other reasons, historically that hasn't been true. And so I am going to request that work be done so that we can have a plan for asset management into the future, and I think it's a responsible thing to do. I think it's actually quite shocking that that hasn't been done previously.
Let's talk about that figure, $14 billion in 10 years, which is an extraordinarily large sum of money. And what we are hearing, what David Mates told us from the Canterbury DHB last night, what the Auckland DHB has told us, the Auckland DHB need about $980 million. And that's just one DHB. The Canterbury DHB, I think from memory, what was it, $1.6, $1.8 billion? And they're running to stand still. Canterbury is spending all that money and not getting any extra beds.
Yeah, John, I think they are large numbers and they are ropey numbers. So let's be clear on that. That's why we need some really solid work done around what the actual costs are likely to be and how to sequence them so that we can sort out associated workforce issues in the construction industry so that we can have a pipeline of projects for infrastructure replacement. These are critical to New Zealand's future, these projects. They are about making sure we have a health system that delivers services to the public in a reliable way that New Zealanders would expect and deserve. They are a priority. So that's why I think that piece of work, actually quantifying the costs and the timeframes, is critical and will need to be done carefully and in a considered fashion. It won't be an overnight exercise. The health system is huge, and I would be surprised, actually, from what I've heard so far, if we even know where all those buildings are.
No, absolutely.
And so it's a big task.
It is a big task. Do you have the money?
John, at the moment, we'll deal with what's in front of us, and I think DHBs, will be frustrated they can't do everything at once, but they will also acknowledge that this government will be getting on with some of that stuff that has been a backlog for some time.
Why is there such a backlog? And the backlog has been so clearly signalled. I'm sitting in the Checkpoint studio with a table full of documents of DHB, even Treasury memos declaring, Treasury, quote, some DHBs look to be sweating their assets and underfunding repairs and maintenance to help balance their books. The Counties Manukau DHB saying to their minister and their ministry in 2016, increasingly tough decisions have been made and will continue to be made, and there was pressure on them to make surpluses while they were making those decisions. What has been going on?
Well, in one sense, it's not mine to explain the actions of the previous government. But what I will say is that there is in a broad way, there's a political debate, a public debate about whether government should be delivering healthcare. in the Labour Party and I believe across this coalition government, we believe there is a need for strong public delivery of health services. The international evidence says strongly delivered public health services mean better population health outcomes, and we believe that to be true. Now, the previous government seemed to believe that by squeezing the health sector you'd promote a private health industry. They were concerned about private profit for that health industry so it could grow, and one way of achieving that would be by squeezing the public delivery of health services. That's not our philosophy, so we will start to address that backlog. I've inherited the problem, but I'm determined to deal with that and lay out a path over time to make sure we rebuild the public capability in our health sector because New Zealand needs it.
Minister, I just want to talk about the kind of advice you're getting as a new minister, and I'm looking at your advisory group, and it contains names like Karen Patasi, who everyone who knows anything about health in New Zealand will be familiar with, Lester Levy, who was the chair of 3 DHBs in Auckland. In other words, these are people who have very much been part of the health establishment. And I wonder if you are going to get the kind of reinvention advice you need.
The advisors on that group are there to give me confidence that the ministry is in a state where it can ensure it's got good oversight and monitoring and leadership in the health sector. I don't think anyone would question that Mr Levy was a strong influence in Auckland. In that sense, he brings that to the table. He has some strong financial skills. It's also true that I want to have another look at Auckland, and Dr Levy tendered his resignation of all 3 chairs, and I have accepted that, and I intend to make sure that we have strong leadership in Auckland into the future so that we do have a clear picture of what needs to be done to rebuild the health system in that part of the country, as I do have an expectation that we'll have a strong picture of what needs to be done across the country.
I've spoken to 2 people who are very senior in DHBs this week. One of them used the word crisis on the record, and one of them used the word crisis off the record. In other words, they didn't want me to say who they were. Do you believe there is a form of crisis in the health system relating to the money that is required to simply catch up with the capital expenditure that has been deferred and delayed and underfunded, and also a crisis of confidence in the health system because of a relationship that was increasingly not constructive between the ministry and the DHBs?
Yeah, I think I've got to be careful here. I think it's easy to blame the Ministry of Health. Actually, the political leadership in the last government was such that the desire was to squeeze the health sector. It was to make sure that staff salaries didn't grow at all, if possible, to make sure that assets were sweated. That's a particular view of the world, and it's aimed at growing the private health sector as a priority rather than ensuring the public delivery of services to New Zealanders. I don't share that philosophy. We have a huge challenge ahead of us as a consequence. We have staff who have been stretched for a very long time, continue to provide amazing service to the public. Every day I hear stories of the amazing experiences New Zealanders have in our health system. No thanks to the previous government, in my view. Those staff continue to do their jobs amazingly well in very stretched circumstances. We have rundown buildings, and we know that we need to address those challenges budget by budget by budget to work our way through them so that we can rebuild the health sector that New Zealanders deserve. Right,
one final question, and we've talked about this figure before, the additional $8 billion over 4 years. Are you going to increase that?
Look, at this stage, that's the pledge we've made. It's the biggest pledge that I think any political party made during the election. We intend to honour it.
But you said previously in this interview it won't be enough.
I have said that that amount of money will start to rebuild the health system. We've got nearly a decade of neglect. You can't fix that all in one budget. I doubt we'll be able to fix it all in one term.
The Health Minister talking to us earlier this afternoon.